coughing for the past month or so. We should go to Dr. Wong.
No, Larissa, I'm fine. It's probably just a changing of weather and the humid climate of Hong Kong.
Are you sure?
Yeah.
Well, if you think it's fine then, I'll go party now. Bye, Mom.
Bye. If anyone you know is showing signs of sickness or symptoms of lung cancer, you should definitely go visit the doctor. That is because this disease could be really dangerous or even fatal if you don't get treated in time. This is what Larissa should have done.
No, I think we should still go to Dr. Wong, just in case.
Okay, fine. You can go in.
Thanks. Are you okay, Mom? Are you okay?
Be careful.
Hi, how may I help you?
I think my mom caught a flu, and she never stops coughing, and she also complains about her chest pain. Sometimes she has trouble breathing.
Oh, really? Are you okay? Can you speak?
Oh my God, Mom, are you okay?
Yeah, I'm fine.
It seems to me that this is much more serious than we expected. I suspect the patient to have lung cancer, but we can't be sure of that until we get further tests to check it.
Up to 25% of the people who suffer from lung cancer show no symptoms until they've taken an X-ray test or a CT scan. However, if there are symptoms, it is usually coughing, shortness of breath, wheezing, chest pain, and coughing up blood. If the cancer has invaded nerves, it might cause excruciating muscle and bone pain. And if the cancer has spread to the brain, it may cause neurological symptoms such as blurred vision, headaches, seizures, strokes, and loss of sensation in parts of the body. Lung cancer can also cause different infections such as pneumonia. Go.
So we just got our test results back, and I'm very sorry to inform you, but your mom does have lung cancer.
What's lung cancer?
Well, lung cancer results from a mutation in the cells, causes them to divide without stopping. There are two main types of cancer. Malignant, which are tumors that basically stay at the spot, just like it stays at the lung. And benign cancer, which are characterized by its ability to spread throughout the body into different body parts. Determining which type of cancer your mom has, we need to do further tests.
Is she gonna be okay? Is she gonna die? Why would she have lung cancer? Is it because of smoking?
Well, there are various ways of getting lung cancer, and smoking is the main contributor. It causing 90% of the deaths. Really indicate that your mom has lung cancer just because of smoking. May I ask how long your mom has been smoking?
About 10 years.
Well, I've heard that the length of the time a person smokes increases the chance of getting lung cancer. This must be the reason, especially when she smokes a pack per day.
That is very true. However, there are also various other ways of getting lung cancer, such as exposure to radon gas, exposure to chemicals, air pollution, previous lung diseases, family history of lung cancer if the trait has been in your family tree for a long time, the past cancer treatments in other body parts, lowered immunity if the person has HIV or AIDS, etc., the patient's diet, and even previous lung diseases.
So what should we do? Is there any way to cure me?
Well, I've heard of several ways to cure cancer. For example, like chemotherapy, chemoradiation, and radiotherapy, lobectomy, and pneumonectomy. Can you elaborate more on that?
Yes, of course. Well, firstly, chemotherapy means using anti-cancer drugs, such as cytotoxic drugs, to destroy cancer cells. And it works by disrupting the growth of such cells. Chemotherapy drugs are also able to circulate in the blood around the body to destroy any cancer cells around the body. Moving on, radiotherapy are used mainly to treat malignant cancer. Here's your report.
Okay. So radiation is like a combination of chemotherapy and radiotherapy, right?
Mm-hmm.
I know that radiotherapy and chemotherapy treatments are able to get rid of small lung cancer cells completely for some people. So there is no sign of cancer on scans or when examined. This is called complete response.
but there is a risk of the cancer coming back after treatment.
So I would need regular checkups, right?
Yes, that is very, very true.
Well, and what's lobectomy? Can you talk more about it?
Wait, which one is the one where we can just cut out all the bad cancer cells?
That is exactly the purpose of lobectomy. It is used to surgically remove all the cancer cells. So it is basically the cleanest one out of all. But it only works for malignant cancers.
Well, Mom, which one do you want to do?
I don't know. They all seem very expensive. I don't want you to waste money.
However, there's also another option, which is pneumonectomy, which is surgically to remove the entire lung. And this is only for people who are very severe, and I don't think your mom is that severe. People who go through this surgery have to carry a breathing machine with them and a fake lung. So if you don't want to treat your cancer as soon as possible, you might be the one of them.
Okay, I will do some further testing, and we'll decide later.
Good idea. 2, 3.
Exposure to radon gas is the second biggest cause of lung cancer after smoking. Constant exposure to chemicals and air pollution, such as fumes and nitrogen gas, can also cause lung cancer. If the patient suffered a previous lung disease that caused scarring in the lungs, such as tuberculosis, or have a past history of cancer, both treatment or within the family, or they have a really low immunity, for example, if they have AIDS or HIV, then it also increases the probability of that person having lung cancer. Overall, the person's diet and lifestyle has a huge impact on whether or not a person will get lung cancer. Hi, doctor.
Hi, doctor. Oh, wow, how great it is to see you guys again. Are you fine now?
Yeah, I'm great. I can even jump now.
I think you're fine. I'm so relieved to know.
Haha, I know, but the process was really difficult.
Yeah, it really takes a strong soul to go through such a process. Mom, you're so brave and optimistic.
I know.
Yes, that is very, very important. A lot of my patients are very pessimistic, and they think they won't be cured, so they end up just dying. But I'm really glad that you're really optimistic.
Yep. Thank you.
We love you, doctor.
No problem.
But be careful! Just because a person has experienced cancer once does not mean that they are immune to cancer, let alone experiencing lung cancer again. Several ways to prevent cancer is not to smoke, avoid cancer-causing environmental agents, stick to a good and healthy diet, and not to consume heavy amounts of alcohol. Also, remember to always remain physically active.